Administration of medication by inhalation through nebulization therapy. And as defined, it is when a nebulizer is attached to a flow of air or oxygen converts a solution of a drug into an aerosol for therapeutic inhalation. Assessment. Evaluate patient's need for nebulization. Evaluate arterial blood gases, sputum cultures, and chest x-rays. Next is review the physician's nebulization order for length of treatment and medications to be used. Next is to assess patient's lung sounds before and after each treatment. Observe consistency, amount, and color of expectorated sputum. Assess need for additional physiotherapy to improve respiratory function. Lastly, assess pulse and respiratory rate to establish baseline data. Objectives. First is to deliver aerosol medication, to promote a better ventilation perfusion ratio by increasing bronchodilation and alveolar ventilation. Next is to prevent or treat atelectasis. Next is to administer mucolytic medication to lower the viscosity of the secretions and aid expectoration. It is also to decrease pulmonary edema, to deliver an antibiotic to a patient with chronic purulent infection such as in cystic fibrosis. Next is to decrease the work of breathing. And lastly is to administer bronchodilators for the relief of bronchospasms associated with respiratory disease such as in asthma, chronic obstructive pulmonary disease, or the COPD. And here are the equipment needed. The prescribed air supply, which is pipe in cylinders or via a portable air compressor. Next is the adapter, nebulizer apparatus or machine, mouthpiece or appropriate oxygen mask, such as a Hudson mask. Next, prescribed medication if dilution of drug is required, sodium chloride 0.9% normally being used. And lastly, the sputum cup, which can be optional. Here are some special considerations for our nebulization. First is the medication as well as its administration by air or oxygen is prescribed by a medical practitioner. Second, it may need to be diluted with 2 to 3 ml of normal saline and it's normally prescribed 3 to 4 times a day. Third, the procedure may be coordinated with chest physiotherapy and may be administered by a nurse or physiotherapist. Fourth, and lastly, for a patient with asthma, an estimation of peak of flow of tidal volume may be recorded before and after nebulizer therapy. And for the evaluation, the nurses should evaluate if there is an increased expectoration of secretions, if the patient experienced less labored breathing, lung sound improves, aerosol medications administered into deep air passages, and ventilation improved. The following is the procedure of the nebulization and its rationale. Gather equipment. Check medication order against the original physician's order according to agency policy. Clarify any consistencies and check the patient's chart for allergies. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Also important to know the actions, special nursing considerations, and safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Place medication in a tray or move the medication cart outside the patient's room. Organization facilitates error-free administration and saves time. Medications will be transported to the patient's bedside carefully and keep the medications in sight at all times. This is to prevent accidental or deliberate disarrangement of medications. Ask the patient to state his or her name or check
Its identification band for identification.
Kaya bali, subong mapasa ta ma'am and
It is
makahelp finish ka
important to
sa atin nga
explain the
target sa
procedure to
natin
the
nga
patient to
lain
gain
mapot ba.
cooperation and ally anxiety. Fill the nebulizer cup with the ordered amount of medication to ensure that the required medication amount is given. Turn on the air compressor to ensure the efficient evaporation of the medication. To check that the equipment is working,
So bali ma'am
fine
dapat
spray should be observed from the nebulizer.
or dapat nga mag-inhale tagit siya ang vapor ya, okay? Papaasa na sa ma'am.
Encourage the patient to breathe the nebulized vapor through the mouthpiece to help the medication travel to the lungs for maximum effect. Remain with the patient until all the solution has been nebulized. Instruct the client to continue the treatment until he or she can no longer see a mist and exhalation.
Ubos na. So, pwede ka kapungko, ma'am.
The medication may help to loosen the bronchial secretions, thus encourage the patient to expectorate.
One, two, pag down o pag release ng breath. Three times.
You can do expectoration exercises or percussion at the client's back.
Hindi na, ma'am.
Ensure that the patient is left feeling as comfortable as possible. Wash and dry the nebulizer, tubing and mask, or mouthpiece with warm soapy water. By doing this properly, the possibility of pathogens entering the client's respiratory tract decreases. Retain the equipment in a polythene bag to prevent infection. Remember to document the nursing practice appropriately, monitor adverse effects, and report any abnormal findings immediately. This is Gwyneth J. Carlos. Thank you for watching.